Anatomy of the brain stem. Neuroanatomy. Lecture 3. Anatomy of the brain stem. Prepared and presented by Dr. Iyad Mosa Hussain, Ph.D. in Neurology, Head of Neurology Department, NASA Hospital. Lecture objectives: 1. Morphological subdivisions of the brain. 2. Site, parts, and functions of the brain stem. 3. Parts of the medulla oblongata. 4. Connection, external, and internal features of the medulla oblongata. 5. Connection, external, and internal features of the pons. 6. Connection, external, and internal features of the midbrain. 7. Location, connections, and functions of the reticular formation of the brain stem. 8. Motor and sensory pathway. Morphological subdivisions of the brain. The cerebrum, formed of right and left cerebral hemisphere. 2. The cerebellum, below the posterior part of the cerebrum. 3. The brain stem, formed of the following parts, from downward. A. Medulla oblongata. B. Pons. C. Midbrain. The brain stem downward. The brain stem lying in front of the cerebellum and occupies the posterior cranial fossa. The brain stem formed of the following parts, from downward. 1. Medulla oblongata. 2. Pons. 3. Midbrain. Functions of the brain stem. 1. It serves as a conduit for the ascending and descending tracts. 2. It contains important reflex centers associated with the control of cardiovascular, respiratory systems and consciousness. 3. It contains the important nuclei of cranial nerves 3 through 12. The medulla oblongata. The medulla oblongata is the lower part of the brain stem, 3 cm. Extent. Above, it is continuous with pons. Below, it is continuous with the spinal cord at their foramen magnum. Parts of the medulla oblongata. Closed medulla, it is the lower half of the medulla, as it encloses a central canal continuous with that of spinal cord. Open medulla, it is the upper half of the medulla, as it opens into the fourth ventricle. External features of the medulla oblongata. A. Anterolateral surface. 1. The anterior median fissure. 2. The pyramid, formed by the pyramidal corticospinal tract. 3. The olive, formed by the inferior olivary nucleus. 4. The anterolateral sulci, gives exit to the hypoglossal nerves. 5. The posterolateral sulci, gives exit to their glossopharyngeal, vagus and cranial accessory nerves. 6. The inferior cerebellar peduncle. B. The posterior surface of the medulla oblongata. 1. The posterior surface of the upper half, open medulla, presents the following features from medial to lateral. A. The median longitudinal fissure. B. Inferior fovea. C. Hypoglossal trigon, triangle. D. Vagal trigon. E. Vestibular trigon. 2. The posterior surface of the lower half, closed. A. Posterior median fissure. B. Gracial tract. C. Cuneate tract. Internal structures of the medulla oblongata. The main nuclei of the medulla oblongata. 1. Gracial nucleus, proprioceptive and fine touch. From the lower half of the body. 2. Cuneate nucleus, proprioceptive and fine touch from the upper half of the body. 3. Inferior olivary nucleus, extrapyramidal function. 4. Inferior salivary nucleus, parasympathetic function via the glossopharyngeal nerve. 5. Spinal nucleus of trigeminal nerve, pain and temperature sensations from the face and scalp via the trigeminal nerve. 6. Solitary nucleus, taste sensations via the facial, glossopharyngeal and vagus nerves. 7. Nucleus ambiguous, pyramidal and extrapyramidal functions via motor fibers of the glossopharyngeal, vagus and accessory nerves. 8. Dorsal nucleus of vagus nerve, parasympathetic via the glossopharyngeal and vagus nerves. 9. Hypoglossal nucleus, motor function of the tongue via hypoglossal nerve. Blood supply of the medulla oblongata. The medulla oblongata is supplied by the vertebral arteries, the anterior spinal artery, the posterior spinal arteries, the posterior inferior cerebellar arteries, the basilar artery. The pons. Extent. It extends from the medulla oblongata below to midbrain above and lies in front of the cerebellum. External features of the pons. A. The anterior surface of the pons presents the following features. 1. The basilar groove, the basilar artery. 2. The transverse streaks, to form middle cerebellar peduncle. 3. The middle cerebellar peduncle. 4. The trigeminal nerve. 5. The abducent nerve. 6. The facial nerve. 7. The vestibule cochlear nerve. B. The posterior surface of the pons presents the following features. 1. The median longitudinal sulcus, the middle line. 2. The medial eminence, produced by the abducent nucleus. 3. The facial colliculus, it produced by the facial nucleus. 4. The medullary stria, transverse nerve fibers, which separate the posterior surface of pons from that of medulla oblongata. 5. Superior fovea. Internal structures of the pons. Pontine nuclei, they form part of the cortico-ponto cerebellar pathway. 2. Transverse fibers, pontocerebellar fibers. 3. Longitudinal fibers, which include pyramidal and cortico-pontine fibers. 4. Nuclei of the trigeminal nerve. A. Motor nucleus. B. Sensory nucleus. 5. Nucleus of the abducent nerve. 6. Nuclei of the facial nerve. Motor nucleus. B. Superior salivary nucleus, parasympathetic function. 7. Nuclei of the vestibulocochlear nerve. 8. Lateral lemniscus, it is a band of ascending fibers, carrying hearing impulses from both ears. 9. Spinal lemniscus, it is a band of ascending fibers, carrying pain, temperature and crude touch from their opposite side of the body below the head. 10. Trigeminal lemniscus, it is a band of ascending fibers carrying pain, temperature and touch and proprioception from the opposite side of the face and scalp. 11. Medial lemniscus, it is a band of ascending fibers, carrying proprioceptive and fine touch from the opposite side of the body below the head. Blood supply of the pons. The pons is supplied by the anterior-inferior cerebellar arteries, the superior cerebellar arteries. The basilar artery gives pontine arteries,